Do you know who's got the biggest brain? You or a baby? At the end, I'm going to give you one medical tip that's really important for your brain development. So stick around to the end as always, and let's get started. So the newborn brain is about the size of a papaya, or 2 mangoes, or 3 oranges, or 4 lemons, or 80 grapes. At first, it's actually a flat plate where the edges of those plates come together and fold over, causing the ectoderm, which is essentially the part of the skin, and then the inner part forms a long tube called the notochord. This will then elongate, forming part of the spinal cord, and then one end will actually form as well the parts of the brain. Do you know what week of gestation this occurs? This is a process that occurs between 5 to 7 weeks. Now, once the brain is formed, it has different functions. You have the frontal lobe, which is that kind of teal color. You have the occipital lobe, which is that reddish color. You also have the sort of greenish color, which is the parietal lobe. And then that brownish color is your temporal lobe. There's a section in the parietal region that controls sensation and motor. Do you know which color controls motor? That's right, it was the yellow color, motor. So that controls really the movement of hands, feet, and other areas in your body. When a baby is born either with a congenital defect, or it develops a stroke, or there's some bleeding and there's an area that's affected, we use this map to be able to prognosticate in the future what type of defects a baby could have when it's a child by looking at some of the areas that are affected. Fun fact, did you know that a baby is born with a head circumference of about 35 centimeters? Now, during the first 3 months and then 6 months, it grows the fastest. Do you want to know how fast? Stick around to find out. Now, the brain is not just made of just straight cells and tissues. Inside the brain, there are actually these ventricles, which are fluid-filled sacs. There are 2 large ventricles, which are your left and right, your lateral ventricles. Then you also have your 3rd ventricle, and then your 4th ventricle. There are connections or aqueducts that are between ventricles. And sometimes, if a baby has some type of bleeding, like for example, intraventricular hemorrhage, some of those blood clots can go into those little ducts, those little canals, and block it, so that fluid cannot get out. And then you begin to accumulate fluid behind that, something called hydrocephalus. That fluid inside is cerebrospinal fluid. Do you know where it's made in the brain? CSF is made in the choroid plexus. This is a structure of a lot of little tiny veins that are located within the lateral ventricles. If you're new to my channel, welcome. In this channel, we basically talk all about babies and neonatology. So if you like the content, go ahead and subscribe, and let's just continue with the lecture. Sounds pretty cool, right? So what is CSF actually made of? Well, it's made of water, but within that, you also have a combination of things. Like, for example, protein. You can also see some type of specific white blood cells or fighting cells, and they're called lymphocytes. You can also see some electrolytes like sodium or chloride, and then finally, you see glucose. The CSF gives you some idea of the environment that's around the brain and the spinal cord. So we can tell if there is an infection or meningitis by seeing if the lymphocytes are elevated. And of course, some bacteria will use up glucose, so you'll have a low glucose with antibodies that are being produced by the body, so you can see elevated protein with that. That is a clear example of meningitis. Do you know how many white blood cells are normal for a baby within the CSF? Hint, it's different in adults. So it's about 20 cells per millimeter cubed. In an adult, it's usually less than 5. So a little bit different, right? Now, did you know that the proportion of the head of a baby in comparison to adult, a baby is actually 1/4 to 1/3 the size of head to body. In an adult, it is 1/8 the size of the head in comparison to the body. And let's look a little bit deeper into the anatomy of the brain. In between the two brains, you actually have a section that connects between those two, and it's called the corpus callosum. Many times we have some genetic defect in a baby and the corpus callosum is missing. Then you know there's some trouble because obviously there's missing connection between the two hemispheres. Now below the corpus callosum is a structure called the thalamus. The thalamus, think of it as the main train station. All the different trains that go to different areas around the city, they all come to the main train station. And that's exactly what the thalamus is. It essentially acts as a relay area for all the different senses except smell. All the senses must go through there, they get processed, and then they go back to the brain of different areas to kind of give you more information as to what's going on. Below that, we have the 3 different structures that come together in that stalk. One is the midbrain, the other kind of that bulbous one is your pons, and right below that is the medulla oblongata. Who doesn't like saying medulla oblongata? I've heard it actually in even songs. Anyway, guess where is your respiratory center located? I'll give you a tip. It's in one of those 3. Yeah, you guessed it right. It's that one again, the medulla oblongata. That's where your respiratory center is. This is why in those like old karate movies, they do the neck chop and somebody passes out. The idea shocks that respiratory center and you can't breathe for a few seconds and you pass out. I don't know if that's real or not. If anybody is into like karate and taekwondo, put them in the comment section because I'd love to learn whether this is true or not. Okay, remember earlier I told you that the newborn is born with a head circumference of approximately 35 centimeters. Well, it grows the fastest between those first 3 months. It actually grows by 2 centimeters per month until it hits 3 months, and then it will grow by 1 centimeter every month until we hit 6 months. After that, it slows down a little bit so that we go from a 35 centimeter head as a newborn to about 46 centimeter as a 1-year-old. Okay, we can't talk about the brain without talking about the neuron, right? So the neuron basically has 3 sections. It has the head, it has the body, which is the axon, and then it has the tail, which are your nerve endings or axon terminals. Now, think of this as a plug, with the head being where you actually plug it into the socket. The actual cord is your axon, and then whatever you plug in is your nerve ending. This is really important because when we are looking at the brain, you have the white matter, and then you also have the gray matter. Gray matter is essentially where you have your head, right? This is where you have the information, and then the white matter is the actual cord itself. All it has when you have white matter damage is that there's been damage to the actual axon, damage to the cord itself, not to the thinking part. That may actually be intact. So we finally get to answer this question about whose brain is bigger, yours or a newborn? Well, it's kind of a tricky question because you see, the brain is smaller in a newborn. It will actually grow 4 times in its life until it gets to the size of an adult. But it actually is born with more neurons. In fact, when you're born, you have all the neurons you'll ever have, the maximum you'll ever have in your life. And it will decrease to half the size of the neurons when you are an adult. Even though the brain is smaller in a baby than that of an adult, actually babies have more neurons than you do. But why stop there? Let's keep learning. You see, what you didn't know is that the brain will actually begin to shrink around the 30 to 40 years age. I know some of you are there. Sorry, we're all beginning to shrink a little bit. What we don't know is how does the brain actually choose which neurons will die off as you get older? That is still a medical mystery. But don't worry, I would never leave you with that doom and gloom piece of news. You see, you can actually make a difference. And today, my medical tip is, if you read more, you do more puzzles, and actually do board games with your kids, you can actually slow that process down and decrease the risk of dementia. So, totally worth having some fun, doing all the things you like, and keeping that brain nice and smart. And so, let me leave you with this thought. Next time you see a baby and they do something silly, before you laugh, remember, they have more neurons than you do. Thank you for watching my channel, The Nicky Doc, and we'll see you with the next video.